Good morning students. Today's class will see in therapeutic relationship and nurse-patient relationship, otherwise NPR in communication. Therapeutic relationship or a helping relationship is type 5 by relationship between a health professional and the client. But especially it is known as the between nurses and their patients of great importance because trust. Development of trust facilitates acceptance of the nurse by the patient. Second is belief, allows the client to believe that the nurse cares about him or her and his or her needs. Nurse-patient relationship is a basic requirement of nursing practice. This relationship finds encouragement when we are feeling down and comfort when we are hurting. Definition: it is an interaction between two persons in which the nurse offers a series of purposeful activities and practice that are useful to the particular client. Characteristic of a nurse-patient relationship include it is an intellectual and emotional bond between the nurse and mainly focused on the client. It respects the client as an individual. It considers family relationship and values, maximizing the client abilities and to participate in decision making. It respects the client confidentiality. It based on mutual trust, respect and acceptance. So these are the characteristics of a nurse-patient relationship. Then there are phases of interpersonal relationship. The nurse-client relation is therapeutic, not a social in nature. So it always the client-centered and goal-directed. It is an objective rather than subjective. The intent of the professional relationship is for client behavior to change. It is limited relationship because once the patient got discharged, the relationship finishes or ends. So it is a limited relationship with the goal of helping the client find more satisfying behavior patterns and coping strategies and increase self-worth. It is not for mutual satisfaction. So phases. Peplau developmental states parallel to the nursing process. The orientation phase correlates with assessment phase of nursing process. Second, identification component of working phase corresponds to the planning phase, whereas exploitation phase parallels to the implementation phase. The final resolution phase of the relationship corresponds to the evaluation phase of nursing process. This will be more clear when you study the nursing process also, because nursing process it is assessment, planning, implementing and evaluating. So assessment comes in the orientation phase, implementing identification is correspond to the planning phase, exploitation phase parallels to the implementation phase, and resolution phase comes to the evaluation phase of nursing process. So pre-interaction phase. Pre-interaction phase is the only one which the client does not directly participate. Awareness of professional goal is important. The pre-interaction phase occurs before you meet the client. That we get an information that the patient is such patient is coming to a particular ward. That is comes as the pre-interaction phase. In this phase, the nurse and client do not have direct communication because from the reception or from the admitting authority, the nurse get information that this particular patient is coming to this particular room. So it comes in the pre-interaction phase. Then second, orientation phase. The nurse enters the relationship in the stranger role and begins the process of developing trust by providing the client with basic information about the nurse and essential information about the purpose, nature, time available for the relationship. It also referred to an introductory or pre-helping phase is important because it sets the tone of the rest of the relationship. It begins when you meet the client. The goal is in this phase is to establish a rapport and trust. This phase begins with introductions followed by initial exchange of information. During this phase, verbal and non-verbal communication occurs. Second is the working phase, otherwise known as identification phase. It is the planning phase. Its conversation in the working phase turn active problem solving to assess the healthcare needs. Clients are able to discuss deeper, more difficult issues and experiment with new role and actions. Working phase focus on self-direction and self-management to whatever extent is possible in promoting the client's health and well-being. It's an active phase of relationship. During this phase, the caring communicator thoughts and feelings are expressed, mutual respect is maintained, and honest verbal and non-verbal expression occurs. The key communication goals are to assist the client with clarified feelings and concern. Next is exploitation phase. It is the use of professional assistance for the problem-solving alternatives. Individual feels an integral part of the helping environment. The principle of interview techniques must be based on the explore, understand, adequately deal with the underlying problem. Patient may fluctuate on independence. Nurse aid the patient in exploiting all avenues of help and progress made towards the final step. Final step is the termination phase. Nurse-client evaluate the client response to treatment, explore the meaning of relationship and what goals have been achieved. Nurse need to be sufficiently aware of their own feelings so that they must use them constructively without imposing them on the client. Patient drifts away and breaks bond with the nurse and healthier emotional balance is demonstrated and both become mature individuals. The termination phase is the conclusion of the relationship, whether at the end of the nurse shift or the client discharged from the unit, facility or the service. If communication has been effective, the termination phase prepares the nurse and client for future interaction. Principles of maintaining interpersonal relationship. Learn everyone's name and never address anyone by nickname or bed number. Respect everyone's individuality. Each member of the team is important. Keep up the status of every member. Do not impose anything on anybody. Keep emotions under control. Do not give and take personal favor. Don't be afraid to admit the ignorance. The team leader should not make any excuse regarding his or her responsibility. Develop the habits of listening and focus attention on the problem. Do not do or say anything that will disturb others' faith. Give importance to others and practice justice. Members of the team should be loyal, honest, dependable, and willing to carry out directions from the team leader. There should be team spirit or team feeling among the members. Each member should work for the interest of the group. There should be mutual understanding between the members. They should be willing to give and take corrections. There should be delegation of responsibility in the group and every member should carry out his or her responsibility to the satisfaction of the group. The relationship between the members of the group should be decent and considerative. Teach the newcomer about the job. Make sure that all the assignments are understood. Newcomer of the group should feel at home when he joins the group. Establish good rapport among the members in order to achieve the aim. Every member should be familiar with organization plan policies of the group. Be up to date with information that is going around. Avoid arguments in the groups. Talk in terms of other men's interest. Praise the slightest improvement made by others. Use words of encouragement. Have smiling face always. Prepare yourself mentally to accept the worst if necessary. These are some of the principles of interpersonal relationship. Now we can see the characteristic of interpersonal relationship. A helping relationship is a therapeutic relationship in nursing which promoting a psychological climate that brings a positive change in the client and promote his group. So there are two types of characteristics, that is facilitative characteristic and action-oriented characteristics. Facilitative characteristics include their essential message for the nurse to establish positive and supportive relationship with the client. These are conditions that create an emotional environment in which the patient feels comfortable and safe. Trust is defined as the belief that other will provide in terms of need and distress. Stress fosters open therapeutic communication to foster the nurses act consistently, reliably, and competently. Empathy. Empathy is an ability to understand and enter the client's frame of reference. Empathy is sensing, comprehensive, and sharing client's frame of reference, beginning with the problem that the client recognizes in other words. It is a phase of sensitive and objective look at what other person experiences. Third one is caring. It is a positive regard for another person. It is a basic in a helping relationship. Nurses can show caring by expediting client as who they are and expecting them as individuals. It promotes trust and decreases anxiety and distress. Autonomy and mutuality. It is ability to self-direct. Mutuality involves sharing with another. These are important in any helping relationship. Genuineness. It is considered to be most basic of helping conditions. The helper needs you be aware of his own feeling. He should be comfortable with who he is so that he does not look out his own feelings from himself. Non-possessive warmth. This simply means unconditional positive regard, respect for others and praising the other. Action-oriented characteristics are the Action-oriented characteristics are used in the nurse-patient relationship to progress beyond the initiation process. Concreteness in communication. A person is helped when he is encouraged to express his concern in a specific and personal terms. Immediacy. The nurse attends to any interpersonal process within the therapeutic relationship. Sensitive confrontation. It is a non-judgmental point out that discriminacy in helping behavior. It should be used carefully and should never be used in earlier phase of therapeutic relationship. So thank you for listening.